Hi there, folks. Do anyone need the COVID vaccine? We got the vaccine available today for you.
In the very early days when we first started giving vaccines, sheer gratitude. We go down to the Tenderloin and we will vaccinate someone, and the gratitude you just almost can't describe.
When we started this work in the Tenderloin, it was one of the hardest hit areas in San Francisco. And through the UCSF effort, the Tenderloin has one of the highest vaccination rates in the city.
When vaccines came out, we were so excited. We could focus on prevention and getting vaccines to the community that was so disproportionately affected in a rapid way. I think one of the things that allowed us to act so quickly, especially in setting up this site, was the long-standing collaboration that we had made since the beginning of COVID with the Latino Task Force.
The Latino Task Force is a collaboration of over 30 Latino serving organizations that have deep roots in the community. We've also been here through every single hard moment that our community has had. So this collaboration coming in made it so much easier for people to trust the science and to trust the test first and now the vaccine.
The Unidos en Salud collaboration is a partnership between UCSF and the Latino Task Force. And there's something so powerful about having medical professionals, the scientists, working hand in hand with community. We do everything in this site together. Since April, we have tested over 50,000 people. We have done over 30,000 vaccines, and I don't think we could have done it without these partnerships.
So Kim and I have worked together previously in completing some of the COVID pandemic response work in a very short turnaround time. And so that was why we were both asked to participate in this initiative.
So UCSF partnered with SFDPH to build the only drive-through mass vaccination site for the city and county of San Francisco. And through this partnership, we were able to deliver over 114,000 doses.
I think from the outset, we absolutely sought to build a model that was adaptable.
We were, up against a lot of different obstacles, supply being the main thing. It was, you're closed tomorrow. No, you have 1,000 doses tomorrow. Now we're vaccinating kids. Now we're not vaccinating kids. I mean, it was a real roller coaster. And the reason why we all got through it and why we were so successful is because of those relationships. We had every level of government official that was actively involved in this site. And then we started to realize, we could bring City College to the community. And so that's how we started to partner with Dr. Malcolm John and the Black Health Initiative, with Dr. Margot Cushell and the Tenderloin, Dr. Kim Rhodes.
You only need a bridge if there is a gap. And what we've come to recognize is that the place where Umoja Health exists is in the gap between public health and healthcare. Back when the pandemic started, there was a really diminished access to testing for African American communities and Latinx communities. We realized that if we did a mass testing site, that we weren't going to reach all of the African American neighborhoods and communities that had high rates of COVID transmission. So we decided what we needed to do was go directly to the community, so we instead adapted a pop-up model for Alameda County. But if we didn't have the partners on the ground letting their networks know, then we wouldn't have had the kind of reach and impact that I think we've had. UCSF's role has really been as a foundational support for information, resources, and for vaccine. Part of our mission is sustaining what we call year-round, non-transactional community partnerships. And we're not going anywhere. And if we want to get to health equity, that's a relationship in perpetuity.